We begin this hour with the effort to eliminate private health insurance and establish a state-run health care program for California residents, and that is moving forward at the state capitol tonight.
Dimitri's Ashley Zavala gives us a clue into what's coming next and the key deadline approaching soon for the bill.
Expanding access to health care is an issue that unites Democrats, but exactly how to do it is dividing them here in California. Governor Gavin Newsom has his own proposal to expand access to health care to all low-income Californians, regardless of immigration status. That is separate from what moved forward today, this single-payer health care bill that some say will cost too much, while others say it will pay off in the long run.
Single-payer health care do pass as amended.
The push to make California the first state with a single-payer health care system cleared its latest hurdle in the Assembly Appropriations Committee Thursday. AB 1400 would get rid of private health insurance and create CalCare, a state-run health insurance program for all California residents. The bill passed on a party line vote with Republicans rejecting, Democrats approving, and one Democrat, Assemblymember Akilah Weber, not voting. The committee approval came with conditions.
Contingent on a statute to create revenue mechanisms to fund CalCare, a fiscal report on whether CalCare can be implemented, and further approval by the legislature.
Assemblymember Ash Kalra is the bill author.
I think the Appropriations Committee ended up perfectly, as far as I'm concerned, sending this to the floor, and now we have to try to get it off the floor of this Assembly within the next 10 days.
The latest committee analysis estimates CalCare could cost about $356.5 billion a year. In a statement, Assembly Budget Vice Chairman Vince Fong wrote in part, the jaw-dropping price tag of this singular program is more than the entire budget proposal of $286 billion proposed by the governor. The bill is linked to a proposal that would fund CalCare with a set of tax increases on businesses and workers called ACA 11. Those increases would require 2/3 vote from lawmakers and need final approval from voters. Ahead of Thursday's approval, more than 120 medical and business groups sent a letter in opposition of CalCare.
There needs to be voters in California saying, yes, this is what we want. That's always been my intention. We first need to pass a policy, so at least the voters will know, Californians will know, hey, this is what we're going to bring to you. And then through the vote, they'll know what that's going to cost.
AB 1400 now heads to the Assembly floor. It must pass by January 31st or else it's dead for the year. At the state capitol, Ashley Zavala, 17 News.